Okay. Well, welcome everyone. Good afternoon, and welcome to the weekly seminar series here at the Dahdaleh Institute for Global Health Research. My name is Dr. James Orbinski, and I'm the director of the Dahdaleh Institute for Global Health Research. And today I'm absolutely delighted to host Megan Corbett-Thompson with her colleagues Jessica Farber and Osman Sow, who will be leading today's seminar, which is titled Methodologies for Co-Designing Community Health Responses in Sierra Leone. And before we start the seminar, I'd like to share that the Dahdaleh Institute is collecting, because of the profound earthquake in Syria and Turkey, the Dahdaleh Institute is working with Adil and obviously with Teresa's great leadership and support to collect donations for earthquake relief. And we're looking for very concrete things, new winter clothes, sanitary products, outdoor essential items such as blankets, sleeping bags, thermos, hand warmers, flashlights, very concrete, practical things that people need in a very difficult situation. And our first round of donations is being collected until tomorrow, Thursday, February 9 at 5 p.m. And we're going to take those things down to a centralized collection site downtown. And if you have any questions about this, just take a look at the document that was sent out in the Zoom, or that will be sent out in the Zoom chat. And then also just like to point out that if there are two organizations that we would support in terms of humanitarian relief, they are Médecins Sans Frontières and also the IFRC, the Red Cross. Both are stellar organizations that are on the ground in Syria and Turkey now, and any support that people are able to offer would be very much welcomed. So with that, I'd like to just begin the seminar formally by acknowledging the indigenous land that we're on. And this is a hybrid event, and so just some people are on different physical territories. So please take time to give thanks and also respect to the land on which you're currently living and working. And today I'm here at York University on the main campus here in Toronto. And we're situated on the traditional territorial area known as Takaranto, and we acknowledge its current treaty holders, which are the Mississaugas of the Credit First Nation. And we also acknowledge that this is the traditional territory of many indigenous nations, including the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. And this territory is subject to the Dish with One Spoon Wampum Belt Covenant, which is an agreement to peaceably share and care for the Great Lakes region. And with that acknowledgement, I'd like to just introduce Megan. Megan holds a Bachelor of Science degree in environmental and ecological determinants of health from McGill. And she's currently the project coordinator for SeeChange, the SeeChange Initiative. And SeeChange is an initiative that Dahdaleh Institute is supporting, and Megan is one of our community fellows. And the SeeChange Initiative itself supports community-led responses to health and climate emergencies. And Megan is particularly focused on humanitarian issues in Latin America, so very specifically human rights, migration, environmental health promotion, and very specifically interested in regions that have become contaminated through harmful mining practices and their human rights and migration and environmental health promotion issues. She has previously interned at UNICEF Geneva. I don't know what that acronym stands for, but the organization is focused on strategic planning and partnership development. And I'd also like to introduce Jessica Farber, who's also a SeeChange leader and she has a BA in International Development, also from McGill. Very big McGill focus here, but anyway, also from McGill. And she's working with Médecins Sans Frontières, or Doctors Without Borders, piloting the community-first approach that has been developed over the last couple of years. And she's experienced in responding to health crises, outreach, advocacy, and project coordination, largely with forced migrants and asylum seekers. And the third participant or presenter is Osman Sow. And Osman holds a Bachelor of Science in Community Health and Clinical Science, not from McGill, but from Dahdaleh University. And he has worked for the U.S. Center for Disease Control and Prevention as a disease surveillance officer. And he's also worked with Save the Children around Ebola as a community health officer. And he's currently working with MSF Holland, supporting SeeChange, the SeeChange Initiative around COVID-19 responses. And I will say that the SeeChange Initiative really developed around COVID and around trying to design and operationalize community engagement strategies for better health outcomes, largely focused on Indigenous communities, not just in Canada, but around the world. It's an enormously successful initiative, has developed a very practical roadmap and very practical set of tools around community engagement, and has a couple of publications already around that describe the initiative and describe its goals and orientation. And I would strongly urge people to take a look at those to get a sense of, first of all, what they're doing, but also to get a sense of how academic NGO partnerships, like the partnership between Dahdaleh and SeeChange, can be incredibly successful and incredibly operationally meaningful. Now, the topic today is, again, methodologies for co-designing community health responses in Sierra Leone. And Megan is going to discuss the process of the community-first methodology and the importance of participatory methods in that approach. And she and Jessica and Osman will talk a little bit about how they understand this methodology around the case of Sierra Leone and their efforts to create meaningful responses or solutions to humanitarian health crises. Following the 20-minute or so presentation, very much encourage question and discussion around what is presented. And this is a 1-hour event. We'll end promptly at 2. And I'll wrap up and conclude around 1:55 or 5 minutes to 2. And with that, I just note that the event's being recorded. Please mute your microphones, excuse me, if you're not asking a question or engaged in discussion. And if you'd like to ask a question and you're one of our virtual guests, you can just use the raise your hand function at the bottom of your screen. And with that, I'd like to ask or invite Megan to begin. Over to you, Megan.
Thank you so much, James. And thank you everyone for being here. And thanks to have Jessica, Osman and I today. I'm just going to share my screen so you can see our presentation. What a great intro. Yeah, so we're very excited. Can everyone see my screen? All good?
Yeah.
Yeah. Okay.
Quite colorful too, Megan. Very pretty. You like it?
Very colorful. Yeah, so we're very excited to be here today to talk to you a bit more about methodologies for co-designing community responses in Sierra Leone. As James mentioned, I'm a community fellow at the Dahdaleh Institute, and I'm researching community-led and decolonized approaches to humanitarian health crises in collaboration, in partnership with SeeChange Initiative. So yes, as James very nicely introduced SeeChange, We work globally with vulnerabilized communities to develop adaptive and sustainable solutions by strengthening communities' crises response safety net. So through this work, we have developed the community first framework with the goal to empower communities to be agents in their own health crises response. So I'm going to go a bit through this. So our community first framework comprises of 4 interconnected phases: connect, engage, mobilize, and reflect. Here we can see the objectives of each phase. So first, in connect, we really build a relationship with the community and understand their priorities and perspectives. In engage, we will then identify community activators who will lead the intervention through all phases of the project cycle. And in mobilize, we then co-design solutions with the community that respond to existing health challenges. And lastly, in reflect, we support the community in achieving its goals sustainably and exchange this knowledge and their experiences. So here are a bit more detail about the steps under the phases of connect, engage, mobilize, and reflect. As you guys can see, connecting is about meeting the community leaders and stakeholders, understanding a bit more of the local context, the relationship with the health services, exploring community assets, and see if the community wishes to collaborate. In engage, we identify the activators, form this technical team, establish agreements, conduct trainings, and then we mobilize. So perform community health assessments, mobilize assets and resources, draft an action plan, and propose solutions to challenges identified. And finally, we have in reflect. We really work with the community to develop indicators and metrics that reflect their own ideas of progress, health, and sustainability. So Jess, Osman, and I have put this framework into practice, responding to COVID-19 and adolescent sexual and reproductive health challenges in Sierra Leone. So to have put it a bit into context, which is what we will be discussing today. So I will pass it along to my colleague Osman, so he can talk a bit more about the context in Sierra Leone.
Hello, good afternoon or good evening to you all. Is it clear, Megan? Are you getting me?
Yes.
Okay,
everything's good.
Okay. Okay, thank you so much for inviting me to this forum, and many greetings to our audiences. And for the Sierra Leone context, and also thanks for the first speakers for introducing us. Of course, they have already mentioned some key important things so that the other audiences can know Usman. So, and for the Sierra Leone context, as we can see from the slides, Sierra Leone is a very poor developing nation, really, and a country that has went through 11 years brutal civil war, which was called senseless one, where about more than 50,000 people lost their life and half of the populations were displaced. And also a nation that the Ebola crisis, around 3,955 people died during the Ebola, and also the COVID-19 pandemic affected Sierra Leone a lot in all aspects of life, including education, agriculture, and other form of livelihoods as well. Sierra Leone is a nation that was ranked in 191 nations, was 181 in the Human Development Index, which is definitely a rough signal for this small country of population of around 8 million and size of 27 square miles, 27,000 square miles. The average population of Sierra Leone's are mostly youth, around 18.8 years of people, and the life expectancy of Sierra Leone is comparatively low compared to developed or other countries, because like for some, you can look at the global life expectancy rate is above 70, 74 or so years. Some countries are even having more than 85 years. But as for Sierra Leone, is around 60. According to some people on the ground, although this is the official figure, but for some people on the ground says, even in reality, perhaps it is something much more lower than this. But however, this is the figure so far regarding this. And for also Sierra Leone, we have challenging situations of lot of communicable diseases that are leading factors of death here, and also non-communicable are also in the increase. Thinking about hypertension and diabetes as well, which is also disturbing the population as well. Of course, the communicable diseases we have increased. We are currently having increased rate of HIV infection transmissions, hepatitis, etc., etc. And of course, the malaria is also still a problem here, because as for me, I work in the pediatric department here in the Maburuka Government Hospital, and we have a lot of cases that are coming of cerebral malaria. Of course, malnutrition is still a very big problem. 73% of the population is food insecure. Like for this one also, some people, if you looked at it well, and if we all looked at the proper definition of food insecurity, you can even say it is even more than 73%. But however, this is also an acceptable one for the sake of data, because most of the farmers here are working on subsistence farming, and also the rain pattern also disturbs the period of farming, and also the yield of these crops are not really sufficient to feed the market. Most of the Sierra Leoneans feeds, and the staple food for Sierra Leoneans is rice, and also 90% of this rice are being imported. And also majority of the youths are jobless, and the few that are employed are the ones taking care of the majority. So you see, so Sierra Leone, this country, the majority of the population lives with less than $1 per day. You see, so the high maternal mortality is still a problem here. Some of these causes can be due to delay in decision taking, bad road networks, and also low human resource, and also low resources to work. Megan, you can move to the next slide, please. From the 2021 until now, SeeChange has been working with communities in Sierra Leone. For Tonkolili, the north part of Sierra Leone, to be specific, like Rowala community. This is a community that has a population of about 5,000 people. And also, as we can see from this picture, like Megan was talking about the Connect, this was the first meeting we have with the community. We are trying to connect and see if there is possibility for collaboration and to work together with this community. This was the time that we got the willingness from the community, and also after this time we were able to introduce the roadmap, the COVID-19 roadmap. From this meeting, we were able to understand that only 3 people who initially took the COVID-19 vaccine, and also it was quite challenging because of the rumors that we are going around. But from the roadmap, we are able to form the health committee, because you can see a population of more than 5,000 only have one community health worker. So from this health committee to form the one in charge of communication, the one in charge of high risk people, vulnerable people, and also infection prevention control. So you see, so that one community health worker cannot truly able to serve a population of more than 5,000. But with the creation of the health committee, together with the community being themselves taking up the responsibility and ownership of their own health, with the support from SeeChange, was quite so amazing. Really, then also people were in charge of health promotions, and also the Rowala community was able to get some support from SeeChange by creating infographics, because there were a lot of rumors of fake informations going. So even one community member mentioned that they are grateful to SeeChange for the infographics, because if the right people with the right information did not meet and talk with the community, then the wrong people with the wrong information will definitely fill in this gap. So vaccine advocacy was done with the Ministry of Health, the district health management team here in Tonkolili district, and also they were trying to see how they can enroll Rowala to some communities because we are going to the neighboring villages for vaccinations. Megan, maybe. Do I have another slide, please? So this is also, this photo was also, Megan, do you want to say something?
No, go ahead, finish up. Yeah, what you saying?
Okay. Then also this photo we are seeing here, this also was the period that we are trying to engage with the communities. Also in Rowala, this picture was taken on my left side of the screen, where we can see lots of people sitting here. This meeting was held at the ABC, the Agricultural Business Center in Rowala. So also talking with stakeholders from communities and also getting their willingness, and also they really see, then also they use this opportunity to talk about the things that is really stressing them up. And also we are all working together to see how this community can utilize their current resources and strength to take care of their own health. And also on the right hand side of the photo, you can see one of an active community member, also a stakeholder by the name of Maxwell. This is one of the secondary school in Rowala, because Rowala have 2 secondary school and 1 primary school. We are busy pasting the infographics that was provided by SeeChange in this school, so that school-going children in the secondary school, primary schools, and also the communities to have the right information about COVID-19, because there were lots and lots of fake rumors going around about the COVID-19 and the vaccine as a whole. So Maxwell and the other community members were also moving with me so that we can paste this infographics. Mika, do you have more time?
Thank you. That was fun. Is that good?
Okay.
Yeah.
So I would like to stop here for now. Thank you so much for listening. Yeah.
Thank you. So we also partnered in 2021 with a community organization called Education Across Borders, and they are based in the east of the country in Kanama and Kailon. And their work is focused in education and youth empowerment. So we partnered with them to develop also a COVID-19 roadmap and action plan similar to Rowala, and health promotion materials. We also organized some vaccine awareness campaigns, and the community organized a committee and strategized their primary health concerns, which mostly centered around WASH. And we have been supporting Education Across Borders to connect with local organizations in the region that also work in WASH. Here are some pictures. I'll pass it along to Jessica.
Perfect. Thank you, Megan. And it's great to be here with all of you. So it's slightly a coincidence that this other project that we're working on with MSF, Doctors Without Borders, happened to have one of our pilot projects also in Sierra Leone. But it was also not a coincidence, because it was it was great for us to have this project, since we already had experience working during COVID-19 with these communities. But it meant that we were able to coordinate and travel together there this past fall. So our project with MSF, with the Transformational Investment Capacity, that's the TIC, is basically to work with them to create a model for MSF to be able to work with communities from the beginning of the project cycle, and to co-design with them, support them to create their own plans for their own action plans for health crisis. So this is based on our experience thus far with SeeChange since 2018. And the idea, this is our first year of the project, hopefully there are many more. And the idea is to do pilot projects within MSF to basically test this framework that we are developing in different contexts and come out with something that can be adapted within the MSF movement within the humanitarian context. So our first pilot project took place in Peru earlier this year on an exploratory mission, as they call it, with an indigenous community. And this was our second pilot project of the year in Tonkolili in Sierra Leone with the Operational Center Amsterdam, so MSF Holland. And during this project, the idea was to work with adolescents in the Mile 91 community, which is in Tonkolili district, on sexual and reproductive health. So to co-design with adolescents a project that they could lead. MSF is already running these adolescent-friendly centers in the projects where they're working in the 3 different projects. They're staffing these centers with a midwife, and these are meant to be government-run centers to provide adolescents with SRH services, but they're basically not run by the government. So MSF is doing that and saw the opportunity to really make something more of this adolescent-friendly space, make it more than just a place where adolescents can come for family planning services, but really a hub. And so we came in to do this pilot project together to see how we could actually co-design with the adolescents and have them be the leaders of that initiative and work with the community organizations as well. So we can go to the next slide, Megan. And so, yes, as I mentioned, we were working with adolescents to strengthen adolescent sexual and reproductive health in Tonkolili. Next slide. So again, with MSF, we are basing the framework that we're developing on these 4 phases. And of course, it looks a little bit different within the MSF context, but that's part of what we're doing at SeeChange too, is to try to partner with different types of organizations and actors to really further this model of supporting communities to pursue their own ideas and initiatives using their own assets. So a big part of the connect phase for us was connecting with local actors in the community of Mile 91. On the right, this is a picture of one of them. It's an actor called Commit and Act, and they are working to provide protection for adolescent girls who have experienced sexual and gender-based violence, many of whom end up being pregnant, and they're providing psychosocial support and shelter as well. And this is an example of a really community-driven organization that MSF could have the opportunity to work with much more and strengthen the referral pathway. And they also are working on FGM, female genital mutilation, as are several of the other organizations that we connected with. And because they are locally run, locally led, they really have the ability to work with these traditional healers and support them to develop other sources of income to actually stop cutting. And so they have very, very wide reaches into the communities. And what we found was that by creating this network of local actors, the reach of the most vulnerabilized adolescents, which we found were those who were not in school, was much greater. So that was what we really focused on in the connect phase, was bringing in these local actors and connecting them with MSF and connecting them more with each other as well, in the hopes of strengthening the referral pathway and reaching more vulnerabilized adolescents. In the engage phase, we worked with the MSF health promotion team very closely to plan and design the coming workshops with adolescents. And we worked with 7 adolescent co-facilitators as well, who were going to help us with the workshops. Next slide. And in Mobilize, we did hold a 2-day workshop for 40 adolescent peer educators that MSF had already identified in Mile 91, and did a series of activities, which Megan is going to explain more about later, I think, called using participatory methodologies, where we did social maps, solutions trees, and maps of the future to support these adolescents to really undertaken a community health analysis from their perspectives, get them to visualize where the assets are in the communities, what are the different factors that actually support sexual and reproductive health of adolescents, what are the different risk factors, what are the threats that they face, where are those threats, and then during the solutions trees activities, actually analyzing the different problems that they are coming up with, that they're seeing, and they talked a lot about FGM, as well as sexual violence, as well as early pregnancy, lack of menstrual hygiene, and analyze what the different causes of those problems, and start to look at solutions. And then as we were mapping the future, they were really envisioning what they wanted the adolescent-friendly clinic to look like. And then we also, working with the network of organizations that we had met, created both a network committee for these organizations to be linked with the Adolescent Center, and also a circle of girls with representatives from each of these organization services to be able to really expand to adolescents who were not in school as well, and more vulnerable adolescents. And then currently still in this phase of reflect, but trying to work with MSF to see how to integrate our recommendations into their projects and really support adolescents to actually take these initiatives forward, start to develop indicators and metrics that are meaningful to adolescents, and see how to also expand this initiative to their other project sites. Oh, there's one more slide, Megan, can you go? Just some photos, I think. But yes, in the top left, this is one of the community organizations that are working with adolescent girls who are not in school and boys through vocational skills development programs. And they were really not connected to MSF at all. So we tried to bring them in. And I think there's a big potential to continue working with this organization further. And then in the bottom right as well, that's our committee of actors, of local actors with MSF. So I'll stop there.
Thank you, Jess. So as Jess mentioned, in December, we had the opportunity to travel to Sierra Leone and meet these partners in person, including Osman, who we'd never actually met in person. So that was really great. And continue building partnerships and really understand the context better and intercultural health aspects, and also develop this community first evidence base. So here are some of the steps I took to connect, engage, mobilize, and reflect. Conducted desk research, interviews, and designed activities and a workshop as well. So we held a 2-day training with 20 Education Across Borders staff from Kenema and Kailon on methodologies on co-designing community responses. So the objectives were to really build the strengths around participatory methodologies, to respond to health challenges, understand social determinants of health, and identify resources to be able to co-design the strategies to respond to identified challenges within their communities in Kenema and Kailon. So here were some activities we did. We looked at the framework, we conducted a strengths analysis of the team, and explored social determinants of health in the region. And as Jess spoke about this as well, that was done as well with the adolescents. We did an activity of participatory methodologies. So this is the social map, solutions tree, and map of the future that Jess also talked about, and here you can see a bit more of the pictures. I hope you can see it on the screen. And so here, yeah, as Jess talked about the social map, and this is where of the community and identifying their resources and points of importance within the community. The second team did a solutions tree where the trunk is really the challenge. And in this case, it was malnutrition in children. The roots are the causes and the branches are solutions that the team brainstormed. And to the right, we see the map of the future. So how they would envision their community. We also spoke about challenges and limitations as an organization, as a team, and we brainstormed some solutions to issues identified and did an exercise building an action plan on WASH. So after we conducted a feedback session and the participants expressed they felt more confident in acting these methodologies to co-design strategies with their respective communities, as well as building an action plan. And they expressed their desire to uplift their organizational capacities. And for next steps, we talked about providing tools for development for the organizational development and support the search for funders and really connect with relevant stakeholders. And also continue to examine how best to support local communities and organizations to ensure best coping and protection strategies for health emergencies. And some reflections we had as well as a team is how can Western partners really adequately support community-based organizations, and also the role of the community first framework. So we spoke about how Western organizations must recognize, respect, and support their partners' visions, priorities, and strengths. We spoke as well, funds were a big topic, and how allocated for community development actually needs to reach the communities and really make funds more accessible and wider reaching. Also to open the space a bit more and provide a platform for community organizations to connect with the audience that they require. And really also just the aspect of uplifting organizational capacities, building leadership, management, operations, and just evaluation capacities to also access these funding opportunities. So yeah, these were all these reflections that we had, and we are, as Jess mentioned, we're still reflecting and seeing how best we can support the communities that we have engaged with. And I'm going to leave it there. I think we went a bit over time, but hopefully everyone is still with us. Thank you so much for listening and being here.
That's great. Thank you very much, Megan and Osman. And I have a whole bunch of questions, but I will ask people to raise their hands if they have a question. And Eunice, I'm going to ask you to go first. But I do want to just put this forward to you, Megan, and Jessica and Osman. And just think about this and perhaps over the next few minutes, find the right time to answer. But the community first approach has now been in place, or you've been practicing this approach and iterating it and improving it in a number of different settings for a number of years now. And do you have a sense objectively in terms of how effective it is? Or do you have any kind of a plan at this stage for actually evaluating formatively or summatively the effectiveness of the community first approach? That's the first question. And the second one is that somehow embedded in your presentation is this idea of resources. This idea of in order to go forward, we need resources. And I'd just like to get your reflection on this. We typically think of resources as money. And your very last point actually was a kind of I thought, perhaps a veiled attempt to address the question of Western donors, donor agencies, and how they can better support or better resource, in other words, give money to this kind of initiative. And I'm not in any way diminishing the really important value of money, But money is just one resource. And I think what is really powerful to me when I look at what you're doing is that you're actually mobilizing a whole package of resources, one of which is money. But the most important resources are the mind, the time, the energy, and the physical resources of a particular community, a meeting space, information technology, other goods and services that may actually be really central to to achieving a particular health outcome. So I'd just like you to, if you could, at some point over the next little while, just comment on those ideas and see if they have any resonance. The first being about evaluation, and the second is, what is your conception of resources? Is it just money, or is it broader than that? And with that, I'll just invite Eunice to ask her question, and Mohammed Sasay, you'll be next. So go ahead, Eunice.
I gotta say, I'm not making this up. Like, I literally wrote, number one, I wanted to ask about evaluation because it seems, Osman, you have been there engaging with the community, and then in December, the other two of you were able to join. So especially in the context of COVID, if you could share any of your reflections about the evaluation of the interventions that you implemented, because I'm sure there were many. I mean, even here in Canada, it's not like before to get people engaged and come together, especially physically. And secondly, I noticed that too in your reflections at the very end about allocating resources. You mentioned that there is a need for that, but I wonder if from discussions within your group, is there a how? Like, how can we, what is the most effective way of allocating the different resources? I guess specifically in the way that James defined it. Thanks. Thank you for that presentation, really.
I want to first thank the presenters for such a valuable work that you're doing. I am Mohammed Sisay. I am an assistant professor in the Department of Social Science here at York. I am really interested in your work. One, because I am the co-PI of a research cluster on epidemic and structural injustices in Black communities. And one of the things that we are doing is to develop what we call a decolonial feminist ethics and methodology. And we are very much interested in building that methodology bottom up, right? So I am really interested in the kind of work that we are doing, because I see some overlap with your work and our own. But also, I am from Sierra Leone, so it's good to see my brother, Usman. In fact, I would thank him in Creole. Thank you, Usman, for all the work you do over there. My comment / question has to do with your interaction with traditional rulers in Sierra Leone. I have done some research work where I have spoken with chiefs in Sierra Leone. As you may know, in the provincial areas, communities are they are structured in what we call chiefdoms, and the heads of the chiefdoms, they are traditional rulers, paramount chiefs, section chiefs, village chiefs, and they tend to be gatekeepers in these communities. They also tend to have some legitimacy and some trust, and people tend to listen to them. But there is also the tendency for some of them to be very elitist in their dealing with the local communities. So I'm just wondering, how is your engagement with traditional rulers who can be very helpful, but also particularly if you are dealing with issues related to the young people, women, there are some challenges there. How are you navigating your relationship with the chiefs in Sierra Leone? Thank you.
Oh, yeah, you've got a bunch of comments and questions, Jessica, and Megan and Osman. And I will say that you know, the work that you presented, just from my own knowledge about what you're doing, what SeeChange has done elsewhere over the last couple of years, this is really just an example of an incredibly well thought out methodology that is applied in a very, at least from what I can see over the years, a very systematic, careful, and dialogic, for lack of a better word, dialogic way. So from what I've seen, it's an enormously successful initiative, and with that, I just hope I invite you to address some of the questions that have been raised. Go ahead, Jessica.
Well, thank you so much for everyone's questions. They're all really interesting, and questions that we have ourselves as well, and that we're also looking at. Mohammed, really nice to meet you. We should definitely be in touch after this. So yeah, Osman, do you want to say something?
Yes, thank you for your questions, and also, yes, let me just try to respond to some of these questions. Then Megan and Jess perhaps will come on board to add things. So as for the resources that are needed, indeed, money is very important, but also like for some of these communities, they need other resources. Like for example, when we are connecting and engaging with, like example, Rwala community, some of their cries are like the work that the indigenous people usually do in Rwala here is farming. So we are talking about these agricultural tools and fertilizers. They said because if they are able to get these tools and fertilizers and other agricultural support, this can boost their livelihood, and in return will help them to reduce or prevent malnutrition, which is one of the key killer in this part of the world. And so it goes in the ways of diverse, and also we are talking about training as well. We are talking about training so that they can be well informed about so many other health topics, because not all of them have radios, not all of them have these big phones, Android phones, to get information or to search, and not all of them can read and write. But if they can get trainings from the within the communities, and also have like some people that are trained to give first aid, this can help them a lot. And these are some of the resources that we are talking about. Also, then also regarding the evaluation issue, like before SeeChange support Rwala with the infographics, which you saw that were pasted in 7 sections in of Rwala community, and you can we engaged, but it was an oral form from 3 people that took the vaccine. After the infographics, it moves up to 50. It moves more than 50 people. So we saw that there was a great progress. But SeeChange and Rwala is still collaborating. The work with Rwala people has not yet ended to properly plan a tool to do a final evaluation to see where it goes. But COVID-19, usually the people, we are willing to work with organizations like SeeChange and other people. But this is what I will have to say. Although yes, they were having their key problems like other things like malaria, malnutrition, livelihood problems. Yeah, but also SeeChange, they know that COVID-19 was a problem, but that really, to be honest, for Rwala and Sierra Leone was not a key problem. Like the malaria issue. Let's stop because of.
Yeah, thank you, Osman. Yeah, and about a bit more about resources, you know, we've recognized this, you know, the capacity of communities and the expertise and the rapid response of the community that can happen, and the different modes of contact, communication, how to get all the logistics. So they have so many resources, and the things that we were asked a lot is more the additional knowledge and skills to address the challenges. There's a lot of willingness to be able to, but then if there's no materials and also knowledge on how to address, for example, with WASH specifically, water, sanitation, hygiene, that would be a resource that was very much needed in certain communities. I don't know if Jess has anything more to add.
Yeah, maybe I can answer a bit Mohammed's question around the working with traditional chiefs and rulers, and probably Osman can complement me a bit more. But yes, that's definitely when we were working in Mile 91 in Tonkalili, for sure an issue that the communities are facing. And I think MSF, because they are not really working with the community organizations as much, and they're mainly working with the Ministry of Health, they're not confronting that so much. But these community organizations really all spoke about the power of uniting together and joining their voices, and they were really eager to have organizations like MSF, and there were other large actors like Concern International in the area, Street Child, to really join their voices, and just talked a lot about the power of having a coalition to be able to speak to these traditional chiefs and healers, and to really understand their concerns as well, especially in terms of the traditional birth attendants who are doing many of the births, the Soways who are doing the cutting for the FGM as well, and other traditional healers, really understanding what their ties to the culture are. And many of them are really very worried that if they are stopping these things, stopping FGM, they have no other way to have an income. And these are people coming from very poor communities as well. So we really look to organizations that had been embedded in these communities for a long time, such as Commit and Act, which has been working for many years and has worked with now 200 Soways who are doing the cutting to actually put down their knives, and they're doing these celebrations of young girls coming into adulthood and turning 18, so celebrating the Bondo culture without actually doing the cutting. And I think there's lots of really great examples of these community-led initiatives. So when we think about resources as well, James, as you said, I think these community-driven initiatives are such important resources, and they're the ones who are always the first responders. They're always going to be there during the crises, and they're really going to be there for the long haul. So I think that one of the best things that these large international actors can do, which there are many, many of them in Sierra Leone, is to really see how they can be working with those organizations, supporting them to be able to put forward the solutions that they're already doing.
Great.
Yeah.
And do you want to comment on evaluation of SeeChange, whether there's a formative evaluation or a summative evaluation approach to actually analyzing and evaluating the effectiveness of the Community First roadmap?
Sure. Yeah. So we are actually involved in a project right now with the University of Toronto called the CORIG Initiative, which is basically an initiative to evaluate exactly the Community First roadmap. And we've been doing interviews with different individuals who were part of the communities that we were working with. And we started actually mainly working with some communities in Latin America, especially in Mexico, Honduras, Guatemala, Peru, Colombia, and then in 2021 started working virtually with Osman and communities in Sierra Leone and in Kenya as well. So this CORIG evaluation is using a series of qualitative and quantitative indicators to actually measure what the communities have gotten out of this and how the knowledge and learnings that they've gained through the COVID response and taking on the roadmap are translating into the responses that they're taking to address other issues, as Osman mentioned, malaria, and trying to confront these different issues that they're facing. And Megan and I actually had the chance to travel to Honduras last year to visit one of the communities that we worked very closely with, and were able to do a bit more of the evaluation. And from both Sierra Leone and Honduras, I think what we found was that the community members who were involved in these responses, and in Honduras it was a lot of women and young people, were very empowered by taking on this response to a health crisis, and it really pushed them to gain more skills, gain more knowledge, and helped them in planning and organizing and responding to the other issues that they were facing. And in both communities as well, they really saw high rates of vaccination coverage in areas where there was originally not so much. And we're still evaluating the results of the interviews and those reflections as part of that CORIG project. But yes, I think we've seen just from the COVID-19 experience that it was a powerful tool. And of course, now we're seeing how that translates to other areas. And it's really been this year that we've introduced the participatory methodologies, which are part of community-based participatory action research, as another tool that we're using to co-design responses with communities. And so as part of the MSF project as well, we're developing a set of a monitoring and evaluation tool that we're going to be using to measure that as well.
That's great. I'll just point out that, obviously, I think one of the objectives of the SeeChange Initiative is to, first of all, create, but also to promote the use of participatory methods in not just research, but in program implementation around the world, with different kinds of and different types of vulnerable people. And in part of the kind of broader mechanism, if you will, of change is good, rigorous evaluation. And if there is a good, rigorous evaluation, there is a extremely high likelihood that good results will be taken up, and good practices will be taken up by other entities and organizations. So it's really, I think, and particularly, for example, here at the Institute, we have a whole bunch of different initiatives around participatory methods. And one of the things that's pretty clear is that participatory methods is very much an emerging approach to future engagement. And the kind of experience and learning that you guys have is really important. And it's really important that is shared beyond the specific little project, right? So evaluation is really also about communication, and also about getting others to adopt the things that you've learned. So just really, really emphasize how important that is. And with that, do you have a quick question, Godfrey?
Yeah. I had 2 or 3, but I'll just limit it. And so in line with the evaluation piece, I thought that it would be good to have a plan in place, because it informs program implementation effectiveness, so that after everything, you have a sense of what you've been able to attain, and it makes the report more focused. But then I was wondering, when it came to co-designing of these programs, did you face any resistance from the community or community leaders, and how did you overcome those? And you talked about infographics. I was wondering what language did you have the infographics in, and how did the dissemination go about? Was it just, putting it up, or it also went through storytelling, some other approaches that you did not make mention of?
I think Osman can speak more about, the infographic. Go ahead.
Thank you for the question for the infographics. And as for the infographics, it was written in English, although the common language here is in Creole. Even if it was written in Creole, not every Sierra Leonean can see it and read that Creole. But it was in English, but also there were pictures in it which can further explain, which can make the infographics which can make the infographic as self-explanatory. It was pasted in schools and different key points, and we are used to sit and discuss other things in different parts of the communities. But before it was pasted, we also held meeting with the community, where we have lots of community members. We took each infographics and explained to them and give them the opportunity to ask questions, make it much more like a discussions before it was before we got permission from the community to go ahead and paste these infographics in the communities. And that is why we saw that the number of people that took the vaccine increased from 3 to more than 50. But really, there are still hiccups because not everybody will be able to read in Sierra Leone, even if it's written in Creole or English. But the photos in these infographics can explain themselves. I don't know if I answered your question. Thank you.
Okay, well, thank you, Osman. And I'd just like to close the seminar by really thanking you for just a great presentation, a really good example, and quite a thorough presentation around the core elements of the community first approach. And you've done a really nice job of just giving us a sense of what SeeChange is about and how it actually implements its vision, and also a very practical example of the community first approach. So thank you, Jessica and Megan and Osman, for that. And with that, I'll just note that our seminar next week is at the same time, same place, and it's with Professor Harvey Skinner, who is going to be presenting on wellness and self-care in global health. And he's going to be presenting on Qigong or Tai Chi practices as they apply to self-care in global health. So with that, again, thank you, Jessica, Megan, and Osman, and we'll see everyone next week. Thank you.
Thanks so much, everyone. Thank you, James, for all of your support as well throughout the years and right now to give us this opportunity. Thanks so much.